Welcome to Call Doctor podcast. Today we have Dr. James Zakaria, very highly experienced surgeon, over 3 decades of experience in general, laparoscopic and bariatric surgery. He is known for his advanced surgical skills, extensive contributions to researches, and commitment to excellent patient care. Welcome, Dr. James Zakaria. How do you define obesity? Is there any primary causes?
Obesity is defined as accumulation of fat in the body to a point that it will cause risk to our health, to the patient's health. So that is the general way of knowing. It's not just only accumulation of fat, but also accumulation of fat that will lead to the risk to the health of the patient. So there is not one primary cause. There are many causes. It's a multifactorial disease. So causes can be, as everybody knows, excessive calorie intake, that means excessive food intake, sedentary lifestyle, to make it very simple. It could be genetic causes. Some people are having those genes which make them put on weight. It could be also due to environmental situations where they're not having enough of lifestyle, where they are going for exercise and lifestyle modifications, where they are, especially in a country like UAE where it is very hot. And psychological causes, stresses, irregular sleep patterns, and so on. So all these things are causing obesity or driving obesity these days.
What are some of the misconceptions that people have about obesity and weight loss?
There are many misconceptions regarding obesity and weight loss. And the number one, I would say, is when people think that it is because of a lack of willpower or it's because of a poor lifestyle. While we know obesity is not just lack of willpower, it is a disease. It is a disease that is driven by various factors and something that the patient cannot correct with his or her willpower. Second one, they think that calorie counting, calorie in, calorie out, because we know that weight gain is not just a product of excess calories. It's how calories are metabolized in the body. For example, there are good calories which are useful for the body, calories which come through whole meal, calories which come through lean meat or good fats. That's very good calorie. And there is bad calories which come through simple calories like through sugars and processed foods. And another misconception is people run when they suddenly recognize one day that they are excess weight, they want to lose weight rapidly. But rapid weight loss actually will only create a rebound weight gain afterwards because it's not sustainable. So weight loss should be always slow. So these are a few misconceptions, but I think main thing is when spouses look at each other and say you don't have the willpower or you don't have the resolution to lose your weight, because it's not under one person's control.
How does obesity increases the risk of cardiovascular disease and hypertension?
As I mentioned, Dr. Rageena, the problem with obesity is not just the person looks heavy and fat. It's about how it affects our health. And one of the main areas it affects is our cardiovascular and hypertension. So how it causes is that excessive accumulation of fat in the body means excessive body weight, which needs excessive blood volume. So the pressure that is there on the heart to pump blood all over the body increases, which causes increase in the blood pressure. Obesity can also increase the cholesterol level in the body, lipids. There are various kinds, especially the very low density lipids and low density LDLs, and these can actually form plaques or atherosclerosis in the blood vessel, which means it forms small blocks in the vessels, which can also raise the blood pressure in the body. It also affects through the kidneys because fat is not just an inert tissue. It has got a lot of hormones, harmful hormones called adipokines. Some of them are called tumor necrosis factor, which people may know, which we give medicines for, or interleukin. These things can affect kidney, it can affect blood vessels, causing changes. In kidney, it can activate a system which causes blood pressure. Most importantly, obesity can cause diabetes. Diabetes is a killer. It causes a lot of havoc in the body, especially in the vessels, where we call it as a small damage microvascular angiopathy, or it can be macrovascular, which also affects heart, eyes, kidney, and the legs and so on. So it is quite a dangerous disease. It's not only about what we see outside, but about the changes that take place in the body because of that.
Doctor, are there any specific warning signs that indicates that the weight has affected the heart health or their overall well-being?
That is the, I think, important point that we should stress in health education is that obesity and diabetes, both being closely related to each other, are silent killers. In other words, you do not realize that your heart or your vital organs have been affected because there are no symptoms. However, there are some subtle symptoms which I would like to share. One is shortness of breath when they are climbing stairs and so on. The other one is swelling of the feet due to weak heart. And some people have some pigmentations on the body, acanthosis nigricans, which can also be an indirect evidence of obesity relating with cardiovascular system. But otherwise, checking of blood pressure, checking of cholesterol, which are simple tests which can be done, could give us an idea how much obesity is affecting the patient's body. And those should give us clues to go for further investigation over the heart, that is ECG, treadmill, or further testing of the coronary angiogram if required.
Doctor, people think that if you're excess weight or you are in obesity, it's a common misconception that you are healthy, or back in our place also it's the same thing that if you're a bit heavy, that means you're nutritionally adequate and you're healthy. What do you think about it?
Well, doctor, we know that is not true. That is not true, but it is definitely there among the population to have this wrong notion that if you're plump, it's a sign of good nutrition. But the sad story is that even those who are overweight, plump, obesity, they may have excess calories in their body, but they are not nutritious. They are malnourished sometimes. They are having a disproportionate collection of nutrients in their body. Some bad things are more, some good things are less. So it's definitely a malnutrition or a dysfunctional nutrition. So they will have deficiencies of many vitamins and they have excess calories, which causes the condition called as metabolic syndrome.
Doctor, do you recommend any strategy that would help people to improve their heart health?
Yes. Whenever we see a person who is overweight or obese and is also having a heart issue, the first thing that as a clinician I do is to find out what grade of obesity is he. Is it below 30 BMI, that is body mass index, or it is class 1 or class 2, class 3. So there is different levels of obesity. So there are certain levels of obesity, for example, more than 35 BMI. We do not want to waste time because they are very risky individuals who can go into trouble. So we directly promote them for bariatric surgery or some reliable way of losing weight. Those who are below 30, that means between 25 and 30 BMI, we advocate simpler measures like dietary modification, lifestyle changes, and sometimes medical treatment. Could be tablets, could be injections like those injections which are now being used for weight loss. And especially concerning the diet, we tell them not to take calorie-dense diets. For example, refined refined foods or processed foods. Simple ways to totally stop processed food, have more whole foods like whole grains or good fats, nuts and things which has got good fats, which is anti-inflammatory. That means it does not cause inflammation in the body. And take more of lean protein, that means protein without much of fat, for example, chicken and things like that. So a dietitian can guide them to use those things which will help them not only lose weight but also have quality nutrition that will prevent inflammation in the body, because inflammation drives cardiovascular problems. So depending upon the level of obesity, they are given the treatment.
Doctor, if a person is trying to lose weight, maybe they are excess weight or they are obese, and having a condition like heart disease or hyperlipidemia or diabetes, what is a reliable way of losing weight?
See, Dr. Rageena, when a person is having weight in addition to a illness like diabetes, hyperlipidemia or hypertension, this is a serious condition which needs medical supervision, where I would advise any patient not to try it on his or her own way. It has to be under the medical supervision and a professional supervision where they can check what is the grade of obesity they have. If the obesity is more than 30, we have stricter measures. If it is less than 30, there are less stricter measures. So starting with the diet, there is a diet which is known as Mediterranean diet, which one can check into, where more of vegetables, fruits, olive oil, things which are anti-inflammatory to the body, lean meat and healthy fats. A Mediterranean diet is said to be one of the best to prevent cardiometabolic disorders in the body. Similarly, this diet for blood pressure, DASH, dietary approach to stop hypertension, which is also available for. So these diets can be only administered by a supervised dietitian and needs to be followed up. But if they are not successful, then one has to look for medical management, like the medications that will reduce diet in form of any of these GLP-1 injections, which are very effective for reducing weight when the BMI is less than, let's say, 35 or 32, so on.
Doctors, can a small weight loss, maybe even 5 to 10 kg, bring a significant improvement in their wellness or heart health?
There are studies which show that 5 to 10% loss of body weight, irrespective of whether it is through the diet or through medications or through any minor procedures, if they can lose that much weight, it definitely will reflect on their cardiometabolic health. So there are measures that provide this kind of a weight loss, which can prevent a person from having the risks of heart disease. The question is if this is sustainable over a long period of time.
From your 35 years of experience seeing excess weight patients or obese patients with multiple conditions, chronic conditions basically, what is your suggestion or your advice that we can do at home to manage their weight?
This is a good question because I think everyone has to now pay attention to this method where they don't wait for problems to happen. Even before that, they can plan their health. So one thing is to be consistent and have a plan for a good health, because when there is no plan in place, then you're opening up for any consequence to come. So a planned way, what I mean is having a regular set apart time for your health. Let's say exercise, number one. Number two, having some regulation regarding what you ingest, what you take in, what is your food. There are many people who don't have any such control. They will eat whatever is on their table and they think they are strong enough to handle. But I think on a long-term basis, I've seen those who are having principles in their lives, consistency, whether it is lifestyle modification, exercise, or choosing the right nutrition diet. People who are conscious about how many steps they walk per day, people who are conscious about how many calories. That attitude is the number one, I would say. Number two, I think having a low threshold to get checkups. For example, not to be waiting for the last minute, but to have that at the age of 40 or at the age of 50. There are certain things that we have to complete. So you go for a ECG or a treadmill test, get a regular blood pressure check. Even if your blood pressure normal, it's good to get your blood pressure checked. So these people who have this kind of lifestyle approach to health, they definitely have good results and good outcomes of their health. This is my general observation. Once you have been diagnosed to have a problem or health risk, then you need to be under medical supervision. You no longer can do things on your own. Then I would also say that since you're involved with the home care services, you could probably be the bridge between those who are taking care of themselves and those who are in a hospital care, where you can provide these tests at home, some of the dietary supervision at home, some of the lifestyle modifications at home, by which they can be helped or handheld to have a more regular life.
Doctor, how does obesity impact health?
Obesity impacts almost every organ in the body. So I'll tell you, for example, as I mentioned before, obesity can cause problems with the heart. Obesity can cause blood pressure. Obesity can cause diabetes, which is pancreas. Obesity can cause fatty liver. Obesity can cause also problems with the kidney, where kidney systems work in such a way causing blood pressure through the renin-angiotensin mechanism. Obesity can cause infertility in women and irregular menses, polycystic ovarian syndrome. Obesity actually can cause high pressure in the abdomen, called abdominal hypertension, which results in various things. For example, it presses the veins and causes swelling of the feet, varicose veins. Obesity can cause osteoarthritis. Obesity can cause backache. Obesity can cause neck issues. Respiratory. Obesity can cause very dangerous sleep apnea, which is quite dangerous also, or obstructive sleep apnea. Obesity can cause asthma. It can cause, headache. So you look at it, and through diabetes, it can cause micro and macrovascular changes, and diabetes affects again all the parts of the body, including loss of limbs, blindness, renal failure. So this is dangerous. In fact, COVID was not as great an epidemic like the epidemic of obesity, which is technically called as ABCD. That is adiposity-based chronic disorders, which affect every part of the body. It is much more widely, spread in the whole globe than any other illness today. So this is an issue that many people are now worried about. In fact, I think in the American election also, we find RFK saying that we want to make America healthier again. So his things about talking about chronic diseases, to control chronic disease which has affected American population so much. And his main thing is to focus upon this, to reduce obesity and good diet for children from that school age itself. That's how dangerous and how important obesity is concerning our health.
What do you think about adolescents having obesity?
This is becoming a very concerning thing, especially in UAE, where we see young children who are unable to go out for play most of the times of the year because of the special climatic changes, and they are in artificial atmospheres to very limited time to play. They are more involved with the screen and their diet, because they are not able to have regular cooked meals from home, or rather they don't like those meals. They like to have fast foods, and they are constantly taking those processed foods which high calorie, simple sodas. And then there is also this thing about epigenetics, which is the kind of changes in the genetic our code due to environment. So if it has affected the mother, the babies also can get affected by obesity. So all these things are we are going into a next generation of people are going to a very high incidence of obesity, which results in all other diseases which I just mentioned, the metabolic syndrome, which is very high in the lower age group than the higher age group nowadays, metabolic syndrome. I would say 3 years back, I had a patient, a 13-year-old who was brought by his parents. At the age of 13, he had heart disease, he has diabetes, he is having blood pressure, and is having all these medications going on. So much so, the endocrinologist who was treating this patient was scared that he may not even survive to the age of 20. He was weighing nearly 140 kilos. So these sort of scenarios are not rare. It's becoming common. If you go to the mall, we can see many of these children who are so difficult to walk, whatever form of dress they wear. So this is dangerous, and the government also, I think, is paying attention and making a lot of changes regarding these things. I would say it should start from home, where parents are able to provide that education as well as the nutrition available at home. It should be supported again in the schools by providing the same kind of attitude. So this continuous education that will help children to be aware of the food that they eat, about the physical activity that they are involved, and also providing those spaces where they can play around, the kind of community safety. Those sort of things will be necessary for a long-term effect to see any changes in the adolescent obesity incidences. And this is being actually attempted in many of the European nations, where they are seeing changes. They could reduce the incidence of adolescent obesity by not just by diet alone, but by changes in the mid-school meal program, the kind of education and the awareness that they are given, and also the knowledge regarding all these macro and micronutrients, what they have to have. So this is very useful. It's not only for their knowledge, it is for their long-term health. We have to go into a campaign mode to tackle this adolescent obesity. Otherwise, waiting for them to have the disease, and I must tell you that patient went through a bariatric surgery, and I'm happy to share that he's doing very well, because once his weight was reduced to a normal level, his BMI from level of around 50 or so came down to 27, 28. He's enjoying perfect health. He became very successful in his +2. He's now in the US pursuing his bachelor's in computer science. So you see, you are not only improving health on one side, you're improving the hopes and the dreams to be fulfilled, because all these children have a future to live. If they are spending their life just by treating their illnesses every time, going from one doctor to another, obesity is not treated by one doctor. You need a respiratory physician, you need an endocrinologist, you need a cardiologist. All these people have to be involved in the treatment of a person, and the amount of money that is spent, and if you multiply it, the amount of expenditure for the insurances and other things is phenomenal. So prevention and preventive measures are to be put in place. That too, not only at the level of government, it has to be at a personal level, home level and school level.
Doctor, what is the role of bariatric surgery in a person having any sort of conditions like heart conditions or obesity?
In cases who are having obesity with heart disease, bariatric surgery can give good results. First of all, I should explain that bariatric surgery is a surgery which changes the metabolism in the body. Though its discovery was accidental, when research was done, it was found that bariatric surgery actually reverses a lot of wrong balances into right balances at the hormonal level. Though we are dealing with only the stomach and the intestines, it was a surprising discovery that our solutions were all connected with our intestinal hormones, especially GLP-1, which nowadays everybody knows about it. So even the cause of diabetes, the cause of obesity, all has been traced into hormones that were secreted from the intestine. So bariatric surgery changes the hormonal balance. It reduces the caloric intake. It also reduces the level of insulin spikes that results with patients who are having diabetes. So when a patient has crossed a certain level of obesity, we call it a BMI, body mass index, above 35. Above 35, we know that this is going to definitely affect their cardiometabolic health, and regular dietary or medical modifications are not successful after the level of BMI 35. So bariatric surgery is strongly recommended. In fact, it's also recommended with patients who are having BMI of 30 but have two metabolic problems like either diabetes or hypertension or any of the two, 13 things about metabolic syndrome. So after bariatric surgery, the results are dramatic. For example, blood sugars become normalized by 5th or 7th day. Their insulin requirements drastically comes down or becomes zero. In fact, if the patient has been operated within 7 years of discovery following diabetes, they have a good chance of complete recovery from diabetes. So the results have been very dramatic. Some of the changes can be reversed. For example, fatty liver, you can have a good resolution. Once, the vascular problems have not proceeded beyond a certain level, things can be reversed. But beyond a certain level, if you have delayed the surgery too long, and then by the time there have been macrovascular changes in the system, resulting in irreversible changes, then bariatric surgery can improve the health but not reverse any of the cardiovascular effects. So bariatric surgery is excellent in cases where dietary and medical modifications cannot bring down the weight, because it's a reliable way and it's a long-standing way of losing weight.
Doctor, what is the role of ongoing care for a patient dealing with obesity?
There is a lot of ongoing care that is required for patients who are dealing with obesity, whether they have undergone bariatric surgery or not. If they have not undergone bariatric surgery, they have to be on weight loss treatment. Weight loss treatment can be namely diet-related, lifestyle-related, and also medication. So all these three fail when patients are not continuously followed up by a professional. So ongoing monitoring of these patients are important, because sometimes when they find that it is not matching their expectations, they tend to fall away. Whether it is diet, and diet is the most important area where they say, okay, it's not working for me, I'll just give it up. Or medications, if they are costly or if they are not, or they have some side effects, they will drop that. Lifestyle, it's again a motivation issue. If they have stress in life or they have some life changes, they will give up. So having somebody to monitor it on a regular basis, some mechanism, whether it's hospital-based or home-based, this monitoring is one way of supporting them to achieve their goals for weight loss. Even those who have had bariatric surgery, they also need to be monitored regularly. And the success of bariatric surgery depends upon how closely they have been followed up, either in the hospital or in some other mechanism through online or at home. So they need follow-up, because one thing is how they are able to handle the changes in the diet, how they are able to adjust their diet to the new, gut that they are having. Are they having any micronutrient deficiencies like vitamin D, vitamin B12, iron, or are they able to maintain the lifestyle changes? Have they got their serum, blood tests regularly done to prevent any major, deficiencies and the diseases resulting because of that? So the ongoing monitoring of the post-op patients should go on to a period of at least intensively for 1 year, and then less frequently for the following years. And there are types of bariatric surgery. Some bariatric surgery like gastric bypass needs much more closer monitoring, because there can be many other symptoms which can be picked up early and prevent complications. So that's why ongoing monitoring is necessary in both obese patients and patients who have undergone bariatric surgery. And that's where probably you can help with your home care services.
Doctor, if there is one thing that you want the listeners to take away after hearing to this podcast, if they are dealing with obesity or heart health, what would it be?
Since this condition is becoming very common, people with obesity are having heart disease and it is a coexisting issue. Few things that I would like to tell is, this is a dangerous combination. It should not be dealt with in a simple way or with self-medications or through medications that are not properly supervised. Number one. Number two is important that you come to know what is your BMI. A BMI above 34, 35 cannot be dealt in a simple way. It needs surgical solution like bariatric surgery. And the earlier you do it, the better the results are for your long term. And it also improves your lifespan. Otherwise, obesity reduces your lifespan. It is not a question of how plump you look. It's a question of your health and it's a question of your lifespan. So that's how important obesity is. And that's one message I wanted to tell them, that whatever you do, do it early and not to delay.
Doctor, what makes you happy being a doctor?
Dr. Rageena, you're also a doctor. The greatest joy is, of course, it is a respectable profession, but the greatest joy is to see somebody smile after you have treated them. Especially in my field as a bariatric surgeon, I just got some message from my patient, say, "Doctor, you have changed my life." And her husband says, not only my wife's life has changed, our family life has changed because of this operation. Comments like this, testimonials like this makes it worth to go that extra mile and, do the tough things that you have to do in your profession.